Hi everyone, welcome to this new video of Magic Ovaries. Today my guest is Julia Bugler. She's a gynecologist based in the clinic of Düsseldorf. That is the biggest fertility clinic belonging to a university clinic in Germany. I met Julia and her colleague Inke at the Congress about Family in Changing Time in Köln. They both build Glückshormon that offers coaching program for people in order to have a better lifestyle and maximize their chances to conceive. They also bring fertility awareness and guide people through medically assisted procreation. Today we're going to talk about eggs. What makes an egg good? Why do their quality actually fall after a certain age? And how does IVF work? All these questions are going to be answered by Julia, but before we jump to the interview, if you haven't subscribed to the channel yet, do it and follow us on Instagram at Magic Ovaries.
That's a very interesting question because as doctors, as fertility specialists, we get asked this all the time. And the answer is there's no way, there's no test to assess the egg quality at this point in time. So unless you undergo IVF and the laboratory can tell you how the eggs react, just like this, you can't measure it. It is possible to measure the quantity, so the amount of the eggs you have left, but not the quality. However, of course, there's statistics that tell us that the peak fertility is probably around the age of 20 to 25. At the age of 30, it's still quite okay, but from the age, it starts declining slowly, and from 35, it can decline really, really rapidly due to the quality of the oocytes getting poor, getting less and less good. So our advice is always think of having kids early, and if you can't or if you're not sure, there's also options to preserve your fertility which aren't discussed as openly in our society yet, and that's also a topic that's very close to our heart and that we want to talk about and inform our audience and let people know that there is something you can do if you don't have a partner, you don't plan on having children now, or just know about your fertility and your options. This is called social freezing, and not everyone, I guess, have heard about it. This is when women freeze their eggs at an age, let's say 30, when this is, I would say, a good age to assess your life. Is it within my plan to have kids within the next couple of years? If it is, then go for it. If it isn't, then this is a good option to consider, because then the egg cells, once they're frozen, will have the same quality, so they stay age 30 regardless of how long they will be frozen. 5 years, 10 years, 100 years, they'll last forever. And if at a later date, 5, maybe even 10 years down the line, you are trying for a baby and it doesn't work, then you always have the option of throwing those egg cells and getting pregnant with your own egg cells with better quality. There's not an official limit. However, we would advise to do it between the age 30 and 35, because the older you get, the poorer the quality will be. So you can still freeze those eggs, but the likelihood of getting pregnant is less. Again, if there was a test to assess the quality, then you could check, but normally we wouldn't advise to freeze your eggs after the age of 40, because the quality would be so poor and the chances of having a kid with them so low that the cost-benefit ratio is not really in your favor. Yes, what makes an egg bad? Actually, it's all the influences that our body are exposed to throughout the whole life. So, or even from before birth, because the peak amount of eggs that a woman would have is actually when this now woman is a fetus inside her mom's womb, and her mom's 3 months pregnant. And from that, the quantity declines. And already the things that the mom, whilst being pregnant with her daughter, the things the mom does, how long she sleeps, how much she drinks, what food she's eating, what chemicals she might be using, whether she lives in a city with poor air quality or whether she lives somewhere outside, this already has an influence. And the same factors have the influence throughout the woman's life, or through the childhood, adolescence, and then adulthood. So very often when women come and see us because they're struggling somewhat with fertility and they want to know, what can I do? The majority of things that you could have done are behind us. There's still things you can do, but I guess my message is, really do care for your body and for your health. It is important how much you sleep. It is important how much you hydrate. It is important what you eat. It is important whether you have excess weight or not, because this all does impact our fertility. And as for the short-term things you could do, we know that the egg cell that will come out of the ovary through ovulation in 1 month actually starts developing from the primordial follicle 3 months before. So the last 3 months before ovulation also have an impact on the egg quality. So this is like the latest where I should start living healthier. As you know, every cell has 23 pairs of chromosomes. And one chromosome is from our dad, the other chromosome from our mom. Together they form a pair that is within us. And because the egg cell will later be met by a sperm who also carries chromosomes, although not a pair, just a single one, still the 2 from the egg cell and the 1 from the sperm would make 3 chromosomes. This is too many. So before the egg meets the sperm, it needs to get rid of half of its chromosomes. This is the first part of the process that's called meiosis. And for that, the chromosomes need to line up at the middle of the cell, and then the pair will be divided. One chromosome moves down, the other chromosome moves up, and even before they do so, they exchange genes. So within one pair, the genes will be exchanged between the maternal and the paternal chromosome before they go on their way. And this is quite a complicated process. They look like threads. The name is mitotic spindle. It's like a thread that's dragging the chromosome towards the pole of the egg cell. And with age, they get very fragile and break. So the older the woman, the older the egg cell, this process can be faulty. When a pair has not divided and subsequently the half of the genome cannot be expelled of the egg cell, it remains within the egg cell. And when the sperm deposits the paternal genome inside the egg cell, there will be 3 chromosomes of the same time. So then a baby with that genetic makeup would have a trisomy. And depending on what pair it is, whether it is 1, 13, 18, 21, it will be not viable at all, or can have some genomic syndromes like the Down syndrome or trisomy 13 and 18, which are viable but sometimes have a shorter life expectancy. Often if the mistake during this process is severe, then the embryo will not develop at all, or the pregnancy will end in a miscarriage. That is a good question. I think I can't answer it in detail, but my viewpoint is that the body is not meant to have children at this younger age because all the hormonal systems just started working. And like with everything in life, you need to do it for some time before you can do it well. So as we know, with the first bleeding, you can't expect a regular cycle straight away. It is okay if it's irregular within the first year or maybe two, because the body needs to find its balance for all the hormone work, to find their balance to work well together in a hormonal cycle. And although you can get pregnant at an early age, that's still not the peak. The egg, when it divides, half the chromosomes will be expulsed, so go out of the egg cell and form a so-called, the German word is Polkörperchen, and it's a pole body, I think, because if you think of the egg as the planet Earth, the pole is like the North Pole and the South Pole, and the middle is the equator. So when the chromosomes line up in the area of the equator, then they go towards the poles, and they just go out in a bubble, which is called a pole body because it is either at the South Pole or at the North Pole of the cell. In the acrosome, so in the very top of the sperm, there's some enzymes that would even destroy the membrane of the egg cell to make a little hole so they can deposit their genetic material. And once one sperm has reached this stage, there's like a mechanism that blocks all the other sperm cells from coming in, preventing too much genetic material from entering the cell. The whole process is quite complicated, so there would be mistakes, and theoretically it's possible for more than one sperm to enter the egg cell, or if there's a problem at any point, then very often it will not develop. The egg cell will not carry on with the normal division. Even if the development happened, the likelihood of that then embryo to implant is less. Even if it does implant, but it is not viable, the pregnancy will then end in miscarriage. And this is exactly the reason why the majority of the miscarriages happen before 12 weeks. The body or the nature recognizes if the embryo is not viable and then just stops the development. And for all the women who are there who have experienced a miscarriage, obviously this is a very sad moment, but the majority of early miscarriages are due to the mistake in this one specific embryo, in this interaction. So only because you had a miscarriage once, it doesn't mean that you can't have children, because this is the one embryo that was wrong, and this does happen quite a lot, I think, and it doesn't mean your egg cells are all bad or something not working at all. I'm not sure if I know of a statistic that shows how many of the eggs that ovulate are good to fertilize. But what we know from statistic looking at pregnancy success rates, that even with a 100% healthy partner or both partners in a couple that are trying for a baby, the success rate is never 100% within one cycle. It's something like 30 to 25%, even in your younger years, even if both partners are absolutely fine. So that suggests that not every egg cell is perfect, although it has ovulated, and obviously there's the male part as well. Still, the statistics show that if both partners are healthy and the woman is in her 20s, 25, 30 years, then after a year, 80 to 85% of the couples will be successful in getting pregnant. then it dies because it cannot develop, it doesn't divide, and then it gets eaten by the macrophages, that the cells that eat up the debris and sometimes also like the viruses, the bacteria, so it doesn't survive. It can, after ovulation, some say it can be fertilized for 18 hours, maybe a maximum of 24 hours, but not longer. This is why it's crucial to have intercourse a couple of days before ovulation, because the oocyte is like a diva. It doesn't like to wait around, and once it's out, it wants to be fertilized straight away. So the time that is needed for the sperm cell to go through the vagina, through the neck of the womb, through the tube, to meet the egg, need to allow for that, so it's for better pregnancy rates. Very often people come to see us when they have tried for a baby and it hasn't worked, but the message is to really know about fertility and to know that it is declining with age, and that is important to actually look after yourself, look after your own body, and have this, the topic of fertility, have it on your agenda, and assessing your situation. Is it within, is it possible, or is it something that I want or plan to have kids in the near future, and not to think that, it has worked for other people, so it will work for me. Or very often the image that's transported by the media is, well, if it doesn't happen, then you go and see a fertility clinic and then it will. But the fertility clinics work with the cells from your body, and if the egg quality is poor, or if there's not many egg cells left, at least in Germany, that there's no like magic wand that we can wave and a baby appears. So it is still crucial to look after yourself so we can work with your hopefully healthy cells. Yes, this is actually an increasing trend because, like you said, the society or the lifestyle is such that very often you have highly educated women who then have a job and are aware of these topics and have done all the homework and are, perfectly informed, and are like in their 30s, maybe in the middle of their 30s or a bit older, still don't have the right partner, or maybe were left by a partner that they thought they would have a family with. They make a choice of having a baby on their own. And this is definitely something that I'm becoming increasingly aware of. Inka and I, we have two hats on. We're fertility doctors and we work in a university hospital. We work in the biggest fertility clinic that belongs to a university hospital in Germany. So there we specialize in fertility, and because our laboratory is also very good, we're very good at IVF and ICSI, so like artificial reproductive medicine. This is the core medical thing. And the other hat is Inka and I have founded Glückshormon as a coaching business to empower women around fertility that is non-medical. And there we talk a lot about health and food. We coach women who have a bit of excess weight. We help them losing weight, becoming more healthy in order to get pregnant quicker. Well, the first thing in Germany would be to make an appointment in a fertility clinic. And I know that it sounds a bit funny to many people, it sounds taboo, but it is really easy. You just ring or write an email, and at the first appointment, the only thing you do is just talk. So nothing will happen, there's nothing lost, and it's just exchange of information, because very often women have heard about it or read about it, but still there are questions and they want to know how it's done, what the costs are, what they need to expect, how many eggs to freeze, and all that we can get across in the first meeting, and then they have plenty of time to decide whether it's something that suits them or not. It is basically the first part of a fertility treatment, but the difference is that the egg cells are frozen without being fertilized. And we always work in cycles, and a cycle is similar to a menstrual cycle. Very often it's like a month, but for freezing your eggs, you only need the first half where the egg matures, and then the ovulation sort of finishes that part. At the beginning of every cycle, there's like many egg cells that want to grow and want to ovulate. And by giving the woman the same hormones that are produced in the body, FSH and sometimes LH, we increase the amount of eggs that actually go through the whole of the development. So all we try to encourage is, well, as many as we can get sometimes, eggs to mature by giving more of the same hormone that is produced by the body anyway. This means that the women inject themselves with the FSH hormone. They most likely it will be 1 injection a day. They also get drugs to stop premature ovulation. This can be an injection or a tablet that you take orally. Very often it would be 1 FSH injection once a day for a period of roughly 2 weeks. And then we do checkups with the ultrasound, and once we see that the egg cells have reached the stage where they're most likely mature, we do the egg retrieval in a 5 to 10 minutes long procedure with some anesthetics, and then the eggs are retrieved vaginally in a very quick and short process and can be frozen straight away. For those women who have had a vaginal ultrasound, this is exactly how it works. And from the ultrasound probe, there's like a small needle that goes through the vaginal skin inside the abdomen, inside the pelvic cavity. And from the ovaries, with that needle, you suck out the follicle fluid with the egg cell in it. And it's you do it under ultrasound guidance, so the person doing it can see what they're doing, and the complication rate of the procedure is very, very low. It's less than 1%. Obviously, if you are taking any drug that has an effect, it can have an adverse effect as well. But nowadays, the hormone treatments are so good that the side effects can still happen, but are very little. And oftentimes, women come to see us and they heard or they read about like crazy side effects, and they expect to be like super emotional or tearful or being like crazy on hormones. But this is still from the time where other protocols, other drugs were used, where long time ago you used like to switch off all the hormones that the woman had, which like can feel like menopause and is not nice and gives you hot flushes, and then give other hormones on top. But this is no longer done, and the majority of treatments would just give you the same hormone you produce in a higher dose, and therefore the side effects are not as severe as many women expect. You can have a bit of a bloated tummy, especially if a woman is very petite, because the ovaries are growing. You can have more vaginal discharge. There could be like unspecific, a headache, maybe a funny feeling in your tummy, and rarely, very rarely, you can get a overstimulation, like a hyperstimulation. But especially if it's a cycle where you freeze the eggs and don't plan on implanting an embryo later, then you can use a drug at the end of the cycle to help the ovaries to calm down much quicker. So through that overstimulation, the risk of thrombosis or embolism is really, really low. And the fact that we are not giving any heparin injections with that treatment, although they exist, shows you that the risk is actually not as high. And obviously still people are concerned about the risks, and this is very understandable because you always want to minimize your risks. But what I often say is that you're doing this because you plan to have a pregnancy later, and the same risks of like thromboembolism or all the things where the hormones are involved, the hormone levels in pregnancy are much higher compared to during the stimulation that you need to freeze your eggs. And also the risk of thromboembolism, it's like at the highest around the birth, so the delivery of the baby and the 6 weeks afterwards. And this is much, much, much higher than the risk during the stimulation of the ovaries. So if you're ready to accept the fact that you will be giving birth to a baby, I think it is okay to also accept the much lower risk of going through the procedure. So at the end of the stimulation, you get another injection to actually release the egg that mimics the function of LH. So the the process of the ovulation will be started, but just before it happens, we need to retrieve the eggs. And by choosing the appropriate drug as the last injection, we can help the ovaries to go back to the normal state very quickly. So typically, at the end of the menstrual cycle, so after 2 weeks post-ovulation, they would be normal in size, depending on how many eggs could be retrieved, and depending on how old the woman is and what the plan is. You can do the same stimulation again at a later date to increase the amount of eggs that you freeze. Well, we check that they have completed the second phase of the meiosis, because only then are they can they be fertilized later. In Germany, it's illegal to be an egg donor.
Oh.
I know, this is crazy. I think there's only one other country, I'm not sure, I think it might be Norway, I'm not sure, but I'm very sure that in Germany it is illegal to have a donor egg or to donate your eggs. Obviously women know about other possibilities and they have to travel abroad. And it is ridiculous, but it is even illegal for the doctors to advise them on that. Obviously, all the lifestyle choices that we mentioned before are very important, but it is also important how you treat your body in terms of how you think and how you speak to yourself, because all cells are interconnected, and the way you go through life and view life, whether it happens to you or happens for you, and whether you are nice to your body and saying nice things to yourself or not, has an impact on life, and through that on fertility. And this is something that we help women with when they come to us for being coached. Inke specializes in nutrition. She has like a degree in vegan nutrition. She really advises people in a structured way how to change their diet in order to become healthy or to get rid of some excess weight. And I specialize in all things that have to do with your mindset. And both of us, Inke and I, obviously know a lot about fertility. The easiest way to find us is on Instagram. As we are in Germany, our name is German, and that is Glückshormon, which means as much as happy hormones. And it's at Glückshormon with an underline at the end. We also have an internet site with the same name, which is www.glückshormon.com.
Thank you for watching this video until the end. I'll see you soon.